Most people understand that if information is used by those treating them, they will benefit. And there's no doubt that for many members of the public, that sharing of information in the interests of their care is something that should happen. And indeed, many patients are very surprised that if they come to a hospital such as the one I work in, everybody that's involved in their treatment doesn't know everything about their medical history. The fact is they don't. So that's clear. But what people have more interest in, I think, at the moment, is the other purposes for which information from health and care is used. So if you think about the services, the fact that you can look at, we can look at through technology, which children in an area have had their immunisation is clearly important in identifying those at risk of common but dangerous diseases such as measles. And then you can think about research, where there's great benefit from understanding new treatments for cancer. We're learning that most cancers are several diseases. Breast cancer, for instance, is many diseases in one diagnosis, with individual treatments of benefit to the patient who then doesn't have quite serious treatment that actually won't benefit them. I think this is an area where we can demonstrate the use of technology so that there's a great deal of work going on to produce clear information for the public available online. There's consideration about how people can relate to the information that they give and understand better how it's used. They wish to know that. If they're involved in research, they want to know what were the outcomes of the research, for instance, and we should get much better at continuing the conversations with the public that we start when we originally discuss with them whether they wish to have their information used or opt out of its use. And I think with growing public awareness, and I'm sure the media will play a part in helping us with this, then we will be in a position where people have many of their questions answered, and we need to show them all the ways in which that can take place. Just have to get much better at having the conversations with the public that they wish us to have, whether it be in primary care, the GP practice, the hospitals, and that work is developing at a pace, in fact, helped by the technology which can support it.